Greetings, everyone. Thank you for joining us here at the 1947 Partition Archive. Given the critical situation South Asia is facing right now with the COVID 19 crisis, we are adding some new programming to our channel to answer your questions about the crisis. Today's topic will be the new dilemmas of COVID 19, black fungus, and steroid overuse. My name is Karina Bhasin, and I'm volunteering to bring you this episode. Joining me is Dr. Ismat Ara Khan. Dr. Ismat Ara Khan will be has joined us from Kolkata, India. This program is streaming live at 9 a.m. Indian time. Just a little brief about Dr. Ismat. This Dr. Ismat Ara Khan is presently in her last year of and a resident doctor in Medical College, Kolkata, pursuing her MD degree in dermatology. She has been working as a frontline doctor since April 2020, when the Chief Minister of Kolkata decided to convert her medical college into the COVID center. So I am really grateful to Dr. Ismat Ara Khan for joining us today, for our audience, for helping us address his concerns. Thank you. It's an honor to have you here with us.
Hello. Hi. Good morning.
Yeah. Good morning, Dr. Ismat. So we will be flooding you with many questions. So you have to beat us.
Yeah. So
Great. Yes. Great, Dr. Ismat. We would like to start with a very simple thing. What is this mucomycosis, presently known as white fungus? What kind of a medical disease it is?
Okay, currently, the world is knowing mucomycosis as the black fungus because of what our media is projecting. But honestly speaking, this is not a black fungus, and scientifically speaking, mucomycosis doesn't have any black pigment in itself. So, since the disease is producing the clinical symptoms being black, so people are naming it as a black fungus, but this is a misnomer and this shouldn't be carried on because fungal taxonomy is a very complex thing. And mucomycosis, it should be called just mucomycosis and not black fungus. So basically, this had always been here in the world. This mucomycosis, the spores are ubiquitous. It is present everywhere in the environment. But now it has resurfaced due to some reason, but it was always there with us.
All right. So this means that it has been before the COVID-19 as well. There have been cases before COVID-19. Is it an old disease?
Yes, it is a very old disease. It has always been with us, but currently, after the COVID pandemic, it has become the first fungal notifiable disease. There are many reasons to it, but as of now, we are seeing a rise in cases of mucomycosis. Yeah.
The next question is, what is since you have said that it is present in the environment, so what basically exact is the source of this fungus? Where is it found in the environment?
It is found everywhere in the environment, like in the soil. In fact, you can get it in Antarctica. You can get it in any geothermal soil. So it is present everywhere. Now, but it usually do not occur in normal human being. When a person is being immunocompromised and inhales the spore, then only you get the disease.
Dr. Ismat, for our audience, could you please help us explain this term immunocompromise?
Yeah, immunocompromise. Immunity is our body's ability to fight whatever pathogen we are encountering in our day-to-day lives. There are many conditions, like any viral disease, there can be acquired condition or congenital conditions which may cause to immunocompromised state, diabetes is an immunocompromised state, HIV, a person infected with HIV virus is an immunocompromised state, people undergoing chemotherapy, radiotherapy for multiple cancer treatment is in immunocompromised state. We can create immunocompromised state with the help of drugs. But in this present scenario, in when there is a pandemic of COVID, we are using a widespread of steroid in the management of the virus. Steroid is a notorious immunosuppressant, though it is basically a anti-inflammatory drug. So we are using it to fight the viral infection, whatever inflammation it is causing. But on the other hand, it impairs our body's ability to fight other pathogens, the steroid.
Thank you. Dr. Ismat, what would I understand from it and simplify it from my audience as well? Immunocompromise means that patients, the part of the population which is infected with COVID-19 as of now, are the ones who are really immunocompromised and hence at a greater risk of this black fungus. Is that
See,
what you meant in the simpler terms?
No, see, the population who is infected by the virus is not solely immunocompromised, but immunocompromised is actually a state when the virus is there and we are treating the virus with steroid. This steroid is causing immunocompromised condition, and like there are many diabetic person in our country. India is having a huge
Diabetic
diabetic.
capital of Asia. Yeah.
Yes, exactly. So in this case, when a COVID person with diabetes and we are treating that person with steroid, so that is an ideal case when the fungus gets its food and it gets a good party time in the body.
I just having a very interesting question. Then why is this not? Why there wasn't any surge of observation of such cases in the first wave of COVID-19? Why is it so much rise in case in the second wave?
Yes. See, in the first wave, also there was a rise in mucomycosis. So there has been studies all over India which reported increase in mucomycosis numbers in the first wave itself. But our media, like Indian media, only reports the cases when the US media reports it. So that is why in the second wave, this focus has come that okay, there are a rising number of mucomycosis. This is one point. Second point is in the first wave the number of COVID cases were not on that higher end. So in the second wave we are having more number of COVID cases, so more people are having chances to get this mucomycosis infection. So these are probably two reasons why we are seeing increased case in the second case. A doctor, a very famous doctor of PGI Chandigarh, sir, he said that there had been studies in the first wave itself, and they have reported cases increasing in number of mucomycosis, but that was actually not seen too.
Right. So, suppose if someone is COVID infected, or as you said, it's an old disease as well. So, someone who is not COVID infected as well, how early can we detect this disease? Is my first question. And how can we detect it? What are the symptoms? How can we diagnose it when we are home?
All right. So, first of all, this disease, it occurs in COVID patients from 8 to 18 days. Median is 18 days. So, when a patient is being discharged, like always after 18 days, usually the patient gets discharged. So, when we as doctors, we are supposed to make the patient aware that yes, you may suffer from mucomycosis. We must tell the patients early symptoms of the disease, like if you feel heaviness on your face, or swelling, or a local pain, or if you feel numbness or nasal discharge, nasal blockage, nasal congestion, headache, or if you're having a fever again, or a toothache even, or a diminished vision. So in all these cases you must immediately report to us.
So the black fungus is affecting the upper part of the body, basically, from the respiratory part to till the brain part. Is this what it is? the most affected
Basically,
area of the body?
basically the fungus, it may affect your upper part of the face, which is known as rhino-orbital cerebral mucomycosis. Now rhino means nose, orbit means eyes, and cerebral means head. So you have that, and then you also have a pulmonary type of the disease where it affects the lungs. Then you also have the gastrointestinal type of the disease. Then you have the cutaneous one, where only the skin is affected. It may be because of a trauma or a burn which may occur, and then the virus infects your skin. From there, you get the disease. And there's another dreaded type that is known as disseminated type. So these are various types of the disease. So the ones which we most commonly see is rhino-orbital cerebral disease, and this most commonly occurs in uncontrolled diabetic patients. So, and the and this COVID scenario is leading us to that only. And the second most common in the COVID scenario is the pulmonary, right after the rhino-orbital cerebral.
So, Dr. Ismat, what I could understand is the patients who are already diabetic are very much prone to have COVID-19, and henceforth the chances to get this infection increases or doubles up for them. So, the diabetic patients, the patient with cardiac history or the neuro history, have to be very, very cautious and preventive. Am I right?
Diabetics are more prone to mucomycosis. Not, I'm not saying that they are more prone to COVID. They're like that thing. I'm not saying, like, yeah, the diabetic patients who are developing COVID, and in fact, I would like to highlight that diabetic patients who are not suffering from COVID, they are also getting mucomycosis. All right. So uncontrolled diabetes and the rampant use of steroid. These are the two predisposing factors, two main factors which are causing this fungal infection in this viral pandemic.
This is very important, Dr. Ismat, for our audience, that the patients, the section of the population which is not COVID infected but diabetic, are very much prone to this infection, to the white fungus, mucomycosis. It is not just because you are developing COVID and hence this is happening to you. It could happen to anyone. It's an old disease. Right.
Yes.
This is helpful. So how can we, what kind of the preventive measures can be taken?
First of all, awareness. You need to people to know that, all right, these are the predisposing factors, I need to avoid them. So the diabetic patients need to control their glycemic index. So if you have your glycemic index in check, then you have less chance of acquiring the infection. Then if you're on any immunosuppressants like steroids or any other drugs, then that may be stopped. And like there are, if you are suffering from any of the early symptoms, go and visit your doctor. Your doctor will advise you for endoscopic biopsy, so just go for that. And if need be, then go for surgery or your medical drugs.
So it is very important not to take any steroid, not to go to your neighborhood friend or take any medicine without the consultation of the doctor. So do you think because of the home isolation, too much of the treatment that is happening at home, people have taken, misused or overused the drugs, is that could possibly also the reason for this increase in cases?
Yes, definitely. Like in the mild cases of COVID, people are already taking steroid from the first day. It is absolutely harmful for any patient to take oral steroids right from the beginning of the disease, and even if the person is suffering from mild disease. So your doctor knows best. Like if your doctor prescribes steroid, then that's only because you're in the moderate group of the COVID disease. But due to shortage of beds and oxygen and whatever crisis we are facing, doctors are forced to treat patients at home even. So many at times, like we tend to tell the patient that yes, you go for the steroids, but that shouldn't be the case. This is the awareness we are creating, that even if it is a mild stage, unless and until your saturation is dropping, do not go for steroids. And but in this scenario, like when the beds are not available, but in fact, if the beds are available but the saturation is falling rapidly, the doctors are forced to increase the steroid level also. Like these are the reasons why we are using a lot of steroids nowadays.
So, for how long one a patient should use the steroids, even if taking care themselves, self-regulatory measure? What is the time frame with under which that steroids should be consumed?
First of
Is
all, the
there any
steroids
specific?
should not be consumed on your own. Your doctor will know the best for you, and the doctor will guide you. You are not supposed to take it at all.
Thank you, Dr. Ismat. So, one another question. There have been a lot of humor and confusion around that since the oxygen was not available, and many people rescued to the industrial oxygen rescued them from a panic situation. Is this also the reason to develop a fungus infection in the respiratory system?
Okay, I would like to address two issues here. First of all, the industrial oxygen and the medical oxygen. Medical oxygen consists of 88% pure oxygen, and the industrial one consists of 98% pure oxygen. So, the amount of oxygen in the industrial oxygen is quite high, and it is toxic to most of the organisms. So, it is not possible for the fungus to grow in the industrial oxygen scenario. There has been studies where there's no evidence of the fungus spore in the industrial oxygen as of now. All right. And one another issue is when people say that we are not using distilled water, we are just using random water for the humidification of oxygen. But I would like to highlight that the bottle in which we humidify the oxygen, it is always undergoing, like we are passing air through water. So it is not static. It is always continuously moving. So it is not possible for fungal spores to grow in a environment which is always moving. So like whatever studies they have done with all those pipelines and all, they have not found any fungal spores.
Which section of the population is more prone? Are the children, the kids, or the like? Is there any specific age group more vulnerable to it?
Yeah, the older age group is more vulnerable, and strangely like more number of cases are seen in men, and obviously the diabetic and the immunocompromised group of the people, they are affected.
One more question: is this a communicable disease?
uh, no, it is not a contagious disease. Like it is like the COVID, it has a high rate of contagions, but this spore, you cannot just contact it very quickly. Yeah, you need to inhale the spores and you need to be immunocompromised, but apart from that, it is not a very dreaded thing. So,
Thank you, Dr. Isma. This is really helpful. One last request for the audience. Could you please help us briefly tell that what is the role of the treatment and what kind of measures while having the treatment we should be taken care of when we start developing the symptoms for COVID or when we contract with this disease? The role of the treatment.
the role of the treatment, first of all, you need to be aware, like you can get the disease like if you're having uncontrolled diabetes, or if you're diabetic, then you should know that okay, I have the higher chance of contacting the disease. In such cases, like I must look out for early signs and symptoms. If I have them, I need to rush to my doctor.
Great. Thank you, Dr. Ismat. On a very last note, do you have any specific advice?
uh, just eat healthy, stay healthy, like wear your mask, like hand washing and maintain social distancing. Do not try to avoid COVID as much as possible. Get yourself vaccinated as soon as possible, and that's it. Just stay healthy.
Thank you. So I think it's the time to take up the questions from the audience. And we have one question from Vikrant Guleria, and he would like to ask, if I am diabetic, is the black fungus infection more likely to impact me seriously? Also, are there any permanent damages it can cause after it is cured? This is a very nice question. Are there any permanent damages to the system once it's cured?
See, basically, the fungus, it enters the blood vessels of our body. So, like once it enters the blood vessel, it spreads very rapidly, and it causes thrombosis and infarction. This means that the supply to the organ, the blood vessels which are providing blood to, is being compromised. So the organ is being damaged. As we can see that it affects eye, it affects brain when it is happening in the rhino-orbital region. In such cases, you have to operate out your eyes, or you need to remove a large chunk of the tissue which it is affecting. So it depends now how much it has invaded in your body, and surgical debridement is usually which helps in better cure. First of all, when the disease is being suspected, so we refer the patient to a ENT surgeon. He conducts endoscopic biopsy. The biopsy results, if we just notify the microbiology department beforehand, so the results can be available with us within 45 minutes. It's a very simple procedure to diagnose the disease. And if you have the fungus, then the surgeon is already there in the OT with the patient. So he can debride. Debridement means he can take out the tissues which are affected with the fungus on the OT table itself. And that doesn't mean that the entire fungus is gone from the body. So after the OT, so the patient is then put on medical drugs. So now if it has entered your eyes or your brain or any part of the body, so that needs to be removed. So that will lead to permanent damage to that organ. Yeah. And one more thing, like once the fungus enters the endothelium, that means the blood vessel lining, so it multiplies very rapidly. So it gives us a very short window span to just and then once you see that the patient is having heaviness on the face, and the next day you see it's a very bad scenario, like it has spread a lot the next day. So
Thank you. Thank you. Yeah, this is a scary state to be in, but yes, this is what we should be informed about, as you said. Before we wrap this up, one of my very personal question, because there are many mutations and variations coming up with this virus. Is this related to somewhat white fungus, yellow fungus? What is it?
the virus are mutating as per their own natural course. But because of that virus, yes, it is leaving a state of inflammation in our body. That inflammation to some extent is leading to immunosuppression, and we are also adding on top of it steroids and other comorbidities like diabetes and all. But that is actually helping these fungus to enter our body and then replicate. But as such, the mutation of virus is not related to any of these fungus.
Thank you. Thank you, Dr. Ismat. It was a wonderful pleasure to host you, to have you for the audience, for us. Thank you for addressing our concerns. Thank you, audience, for joining us in today. So we will be hosting episodes on numerous topics related to COVID several times a week at 9 a.m. Indian time. Please follow us on Facebook and subscribe on the YouTube to catch all the episodes. Thank you. Thank you, Dr. Ismat,
Thank you.
once again.
Thank you.